Hello, Northglenn. Thank you so much for joining us this evening. I'm Mayor Meredith Leighty, and we also have City Manager Heather Geyer.
Good evening.
Clay Cunningham from Community Reach.
Hello, everyone.
And Dr. Bernadette Albanese from Tri-County Health Department.
Hello.
Before jumping into our main topics and taking questions, we'll chat for a bit as all of our telephone invite calls go through. This telephone town hall format gives us a chance to talk through community concerns. For example, on our last town hall, residents brought up needing additional residential trash service because of the at-home order. In response, we have brought back special pickups for residents and the Yard Waste Drop-Off Center at 12301 Claude Court will be open on Saturdays from 8 a.m. to 3 p.m. beginning this Saturday, April 11th. Other residents were concerned about heavy use of our parks and trails and people not social distancing. Heather, would you like to talk a little bit about that?
Yes, thank you, Mayor. Enforcement of various public health orders is a challenge at the very least. These orders are new territory for us as a municipality and the community at large. Situations are not always black and white. We each probably have a different perception of what compliance truly looks like. The City of Northglenn has decided to focus on education. We have increased our presence and patrols of our public areas and parks, open spaces, trails, as well as in our neighborhoods and business communities. So far, our residents and businesses have complied, and they understand the need to keep social distancing guidelines, which is 6 feet apart from anyone outside their household, and that there are no gatherings in groups of 4 or more. Now we are encouraging everyone to wear masks wherever they leave their home. It is a lot, I know, and this can cause anxiety. So educating people on the expectations and encouraging them to comply seems to be the best course at this point in time. I urge residents, please follow the public health orders issued by the governor. We also need to accept that we cannot control everyone's behavior at all times. Our officers, are active on patrol. However, they are still responding to calls that come in a priority manner, whether those are medical calls or response to criminal behavior. Residents may call the non-emergency police number to report behavior if you feel like there's a violation of the state health orders, but I recommend that you really make sure you understand the behavior that's taking place that particular moment in time, and then make the call if you feel like there is a clear violation. So, for example, if you're out in one of our parks on a walk or a jog and you see a group of individuals of 25 or more, say, having a party at a park pavilion, this is clearly a violation of the state orders. 4 teens playing hacky sack in one of our parks may not be a violation, and you may, want to encourage them to practice social distancing. Certainly, if you feel like you need to call the police department, then that is what our officers will do. They will reach out to that group and let them know that they need to practice social distancing guidelines, as well as a group who may be using a pavilion. All of our pavilions are closed at this time in our parks. So just encourage you to, reach out to us if you need help, but these are some tips for you to use.
Just a reminder to everybody that's on the phone, if you want to ask a question, please hit *3. So if you are on the phone and want to ask a question, hit *3. If you are watching the live stream, the audio of this on your computer, you can just type in your question. We'll be fielding questions in just a moment, but did want to hand off to the mayor again and listen to a little bit from one of our guests.
Yeah, so thank you, Heather, for all of those specific suggestions. This is a challenging situation. We want everyone to stay safe and healthy, and sometimes getting out is a matter of mental health, which is a great transition to Clay. Clay, the Community Reach Center is a great resource. Can you tell us a bit about what you do, what you're hearing from residents, and some tips to keep us all sane during this crazy time?
Certainly, yes. Thank you, Mayor Leighty, and hello to everyone on the call. Again, my name is Clay Cunningham. I'm the Chief Operations Officer at Community Reach Center, which is the community mental health center serving Adams and Broomfield counties. I appreciate the request to speak at the town hall and talk about some of the mental health challenges being experienced by our community related to COVID-19, and then discuss some of the available resources we have. I want to first acknowledge, I don't think there's a single person in our community that has not felt a significant strain on their mental health and well-being in some way during this public health crisis. I think we could all say that we've experienced at least intermittent increases in stress and anxiety, and I really want to reinforce that that is completely normal. Significant numbers of us may also be experiencing feelings of depression due to being out of work and being disconnected from friends and colleagues and other loved ones, and that is certainly what we're hearing from folks in our community. It may seem like common sense, but it's really crucial that everyone is intentionally engaging in activities of self-care on a daily basis. And it's also really important that we're reaching out to those people that we know that may be more socially isolated and making sure that they're doing as much as they can to care for themselves. And it's really important to create a daily routine that includes getting outside, exercising, working on house projects, and if you have kids in your lives, doing as many non-TV activities as possible. When we experience anxiety and stress, our tendency to isolate and sit around, and for some of us, increase our use of alcohol and other substances occurs, and so we have to be really mindful about building in those activities that really can help to buffer us from negative emotions. It is important for you to recognize in you and your family or someone that you may know that you may need additional support if mental health challenges are becoming unmanageable. And really the best way to know if this is the case is if you're not able to attend to the day-to-day demands of your life, or if your negative emotions are persistent throughout the day, if you're not sleeping well, or especially if you're feeling hopeless in your life or helpless, and especially if you're having thoughts of suicide. So Community Reach is considered to be an essential provider of healthcare services, and we are open for business in all of our levels of care, with many of our services provided using telehealth. Also, all of our 24/7 programs are still fully operational, including our behavioral health urgent care walk-in facility and our detox facility in Westminster. And if you don't know if you want to pursue formal mental health treatment, but you know you're not doing well and just need somebody to talk to, you can either call or text the Colorado Crisis Services line, and you'll be able to talk or text with your choice of a licensed therapist or peer specialist 24/7 for free. And so those numbers and information about any of our services you can find by visiting communityreachcenter.org. Again, thank you so much for your time. I really appreciate it.
Clay, thank you so much. I wanted to highlight a couple of things that you mentioned. One of those being the screen time, especially because our kids are on the screen to do all of their academics right now. They're doing all of their schooling online, so additional screen time. I really liked that you made that point. But also, everything that you just mentioned goes hand in hand with what Heather talked about in our intro, because we have a lot of families that want to get outside as part of preserving their mental health, as part of that self-care, is getting some sunshine, going for a walk, and so I thought you elevated some really great points. I appreciate it.
Certainly.
So to our people on the phone, just a reminder, if you have a question, please hit *3 to ask your questions. And we not only have the mayor here, we have our city manager, we have a representative from Community Health with mental health questions, and we also have a representative from Tri-County Health with any physical health questions or questions about COVID-19. So we're going to go to a call now. Daryl, I hope that you're ready. This one will probably go to the city manager. Daryl, Are you there?
Yes, I am. You ready?
We're ready. Ask your question.
Hey, yeah, I just was wondering, out here, the police activity is really down around this area. I haven't hardly seen any police cruisers around, any police activity at all. I was wondering what the police force is up to in the city of Northglenn. I know they need to protect themselves, but I was just wondering about the activity here in Northglenn. And also, I was wondering how are we taking care of the transient people, the indigent people that I've noticed in the area around here. They need to be taken care of, protected against this virus also. And also, one more question is, how come you guys don't have this on Channel 8 so we can see you guys and see what's going on?
This is Heather Geyer, the city manager. Thank you for your questions. I'll address your first couple of questions that you have regarding the police force. Our police force is doing well, and they are active on patrol. Because you don't see a patrol officer drive down your street, that's not necessarily a bad thing. The police have been active in assisting the school district with their lunch program, Grab and Go. We've also been assisting the school district during the day in terms of they had Google Chromebook pickup just recently. I believe that was within the last week. They are continuing to respond to calls. Those are based on priority of type of call. So please be assured that we have an active force on our streets, and that's been consistent throughout the past month. We have shifted our scheduling for patrol in order to allow for social distancing and provide backup when we need it if by chance we have to have, if an officer experiences an exposure and we have to take that officer off the street and backfill the position. So be assured that we're adequately staffed. In terms of your question regarding homeless individuals in the city, we are working with Officer Jeremy Lund, keeps a good handle on making contact with those individuals as well as patrol officers. We have been notified of certain camps in the city. Most recently, we've gone through and looked at areas around the marketplace, south of 104th, and a few other areas. Our officers do reach out to homeless individuals and make sure that we provide them with resources so that way they have shelter, especially on severe weather nights. We're actively working with Adams County in their Office of Poverty and Homelessness and in partnership with them in order to make sure that there's sheltering on those severe weather nights and food and other resources provided to individuals in our community that are experiencing homelessness. And then, Diana, did you want to address the question about?
Yes, somebody asked why we weren't on Channel 8 or on YouTube for this particular meeting. So we're able to do virtual meetings for our city council meetings, and we're going to put that on YouTube and Channel 8. But this particular meeting, we call out to people. So it's a telephone platform. We would be able to do a webcam, but we're all social distancing. So the couple of people that are in the room are pretty far apart and hard to capture on camera. And then our other guests are actually calling in from remote locations. So really don't have much to show on a camera at the moment, since we wanted to use a platform where we allow people to all call in and listen in as opposed to just watch something on a screen. Great question, though. Hopefully when we are out of this, we'll be able to put everybody nice and close together and show them on a webcam for our telephone town halls, but just not quite yet because of social distancing. We have a few questions about homelessness, so hopefully you all got that answered. Resources for seniors is a good one, so I'm going to go to Bob. Bob, hopefully you're on the line and ready to go live.
Oh, well.
Bob, are you there?
On TV now, I don't know if it's that one or...
I think I clicked on Bob, but I'm not sure.
No, evidently. I'm here.
Hi, Bob. You had a question about seniors, is that correct?
Yeah, I just kind of want to know what resources the city of Northglenn has for us seniors that were stuck in our houses. And
and I also wanted to tell you that, we can't get Dish. We have Dish, and we can't get Channel 8, so we never get to see all those things.
Okay. Bob, this is Mayor Leighty, and I'm not quite sure that I can support the answer about Dish Network. I think that's just a contract piece. Sounds like Comcast.
So this is Heather, the city manager. We have a franchise with Comcast, and they provide our local government access channel, Channel 8, through that franchise agreement with the city. So you can access Channel 8 either via that cable subscription, or you can access Channel 8 programming via our city website.
Okay, so but what about the senior? What kind of things do you have for the seniors in Northglenn that are stuck in their houses? Is there any?
Yes, Bob. Yes. No, that's a really good question, and I'm glad you asked it. We have quite a few things. It depends on what you need. So our police department has a program where they will pick up your prescriptions for you and bring them to your home for free. So that's one of the things that we have in place. Adams County has an organization called the Seniors Resource Center, and if you reach out to them, which we will provide this information. I don't have that phone number handy, but the Seniors Resource Center through Adams County will provide a lot of free services for seniors, so anybody 60 and over. So you can call them, and they will, if you need a phone bank, not a phone bank, if there's not enough numbers there. If you need a food bank pickup, if you need grocery delivery, anything else you might need, the Seniors Resource Center or Seniors Center Resources, I don't know. The phone number, I'm going to give it to you, so if you want to write it down, is 303-238-8151. So I'll repeat that in a moment, but that is probably the most broad service. It's any Adams County resident 60 and above, and they provide quite a few things. Lots of transportation for medical trips, food. Once again, their number is 303-238-8151. And for any of our residents that are already a part of the RTD Access-A-Ride service, they can use the Access-A-Ride service for free to also get their groceries delivered. So that's another service. But can I ask specifically, Bob, what you might need help with? Because maybe you could give us a new idea.
Well, yeah, mainly getting our groceries and some prescriptions, but it's just the everyday thing that us seniors have to put up with. We can't go to the grocery store, so that's what we do.
True.
How do you access the prescriptions to be delivered? Where do you go? Who do you call?
The police.
You call the police?
Yes, and we have a number for that. Our city manager is looking that up right now. It's the general number for the police department.
Okay.
And that number, are you ready to write it down?
Yes.
Okay. It's the 450-8892.
Thank you.
You're welcome. And Bob, I took your number down. You can always give the city a call or send us an email and let us know if you have any specific requests, and we will see what we can do to help you.
Thank you.
And Bob,
so
we're not
much.
going to get Channel 8 for you on your TV, but you can always watch us on YouTube, and you would access that through our website, www.northglenn.org. Thank you for calling. We have a long queue of calls, so I'm going to jump off. Let's see. Somebody had a question about block parties on their block. So I believe this is Christine. Kelly, Christine, are you there?
Hi, I'm here, yes. Can you hear me okay?
We can, thank you.
Okay,
Christine,
good.
this is,
Go ahead and ask your question.
what is your question?
So my concern is, and well, first of all, I do really appreciate all the police and mayor and everything that you guys do. I work home health care. I provide medical services in homes. And I'm very concerned about my particular neighborhood. I go to other neighborhoods and I don't see this problem, but every time I come home from work, there's block parties going on. So I'm limited. Like, I can't work in my front yard because of the gatherings. I can't get my mail because of the gatherings. I can't go for a walk because of the gatherings. I've called the police at one time and asked dispatch to have them come over and drive by just to inform people that they could have a $995 ticket, or they could serve time in jail for these parties because they could be killing people. I mean, there's children involved, there's adults, and I'm just wondering why the police never drove by. I mean, I know you guys are busy, but this is a critical time, and like every single day for over a month, they've had block parties. Obviously, they don't have to go to work. They don't have that type of job, so they're utilizing their time to party. And I'm really disturbed because I've seen, a lot of people not do so well with this virus, and a lot of people die from this virus. So I don't want to get it from my patients, and I'm concerned because, how can I go for a walk? Can I go to the parks and go for a walk? I'm trying to keep social distance for my own patients and myself, but then when I have these block parties right in front of my house every single day, and I can't get the mail and I can't go for a walk, it's very disturbing, and I don't know what to do. Is there a solution to this? Is there a way to stop these, or a way for me to go out for a walk and do my normal exercises that I used to do before the COVID-19 block parties in my neighborhood?
Yeah, so Christine, this is Mayor Leighty. I really appreciate you raising this concern. I've actually heard about this from people I know in other cities. I did not know we had that issue. The first thing I would say is anytime you do not receive a response, I would call again. You are protected by our Northglenn Police Department, and if you are not seeing that they're responding, because it could be that they get busy and a call takes them off, call them again. Just get back in line in the queue and call them again. You sent us an email, and so we have some specific locations, and I know City Manager Geyer and I are both going to follow up on that because you're right. Everything you said is 100% correct. It is not safe. They are violating the order, and it's endangering their neighbors because we do want you to be able to go for a walk and check your mail and feel confident doing that. So I appreciate you calling and raising that concern.
Thank you.
You want to add to that? No? Okay.
All right, thanks for calling, Christine. We really appreciate it.
Thank you.
So while we're going to another call, somebody was talking about, with all the roads being less congested, what are the plans for regular road maintenance as well as possibly increasing road projects? So City Manager, do you want to talk about that a little bit while I go to find our next caller?
Certainly. So, you want me to go ahead and go?
Yeah,
go.
Sorry about that. This is City Manager Geyer. We are actively working on road projects right now, filling potholes. Crews are utilizing social distancing guidelines, so it won't be uncommon if you see one staff member from Public Works in a truck working solo as compared to, say, when you've probably in the past seen groups, a crew of Public Works employees working on a different specific project location. We are preparing to take our 2020 residential street program contract to City Council on Monday night for approval. So we are continuing to move forward with recommending specific roads for rehabilitation this year. We're on target with the timing of this overall project, and so we will be sharing more with the community, assuming that City Council approves that residential street program contract on Monday evening. I'm happy to answer any specific questions related to specific streets. I don't have that information in front of me, but certainly I could follow up and get back to you with more specific information if you'd like.
Right. And this question came from online, so you would just type in the question there and we'd get back to you. We're going to go to a live caller now. Michelle, hopefully you're ready. Michelle,
Yes.
Are you there? Please ask your question.
I am here. Thank you. I was just wondering, for those of us who are, a little less risk and able to get out, where would we call if we want to volunteer to help, get the groceries for the seniors or pick up stuff for them, or, where would we call if we want to volunteer our time to help out the people that, can't get out of their houses?
So, Michelle, that question just warms my heart. I think it's very sweet. And we do have a lot of residents that would like to help our seniors out. So there are a couple of things I can direct you to. We have a Northglenn Cares Facebook group, and that group was designed to pair up people that have an opportunity to volunteer with people that have a need. It didn't have to be seniors. It could be parents with young kids that are also at risk, and so we wanted to make sure we had a location that people could go. So the Northglenn Cares Facebook group, if you join that, we can help connect people. Another great organization is called the Shout program, and it is a volunteer program through the Senior Hub. And so if you have a pen, I'm going to give you their number.
I do.
It is 720-523-2820.
Thank you so much.
Yeah, no, I really appreciate you raising that question. So thanks for calling. And before we move on, we have a long list of calls, which I am very excited about. We want to get to as many as possible, so I wanted to answer one of the quick questions. A caller has asked, what is our official number of Northglenn residents that have been infected with COVID-19? And as of today, our total is 23. And that number is updated every evening at 6 p.m. So our current number is 23. So I just wanted to get to that one really quickly.
All right. So we have a Tri-County health person on the line, and we see somebody is asking about testing. So we're going to go to that one, or I'm going to try to if I can find it. There we go, testing. So Sherry, we're going to go to you. Dr. Albanese, hopefully you're ready. Sherry, what's your question?
Hi there. It has to do with COVID-19 testing. If someone is showing symptoms of COVID-19 like fever, cough, sore throat, loss of taste or smell, or shortness of breath, is there any testing currently available in Northglenn or Adams County?
Yeah, hi Sherry, this is Dr. Albanese. Yeah, hi Sherry, thanks for that question. Dr. Albanese with Tri-County Health Department.
Thank you.
So right now, the testing is primarily needs to be arranged through your healthcare provider. There aren't established what we call community testing sites. It probably through most of the metro region. So your best bet is to contact your healthcare provider and see if they can refer you for testing. Hopefully if someone is sick, their symptoms are not serious enough to have to, go to an emergency department or an urgent care center. Those individuals that are sick enough to need that level of care, would have testing arranged through those facilities. The state and several of the health departments in the Denver metro area are actively working and strategizing on how to address some more options for what we call community testing, just to improve the availability for testing. There's a lot of nuances about that. We have, the healthcare providers can use commercial laboratories like Quest and LabCorp for testing. The hospitals, many of the hospitals in the metro area, the larger hospitals have accessibility to testing. Some actually have brought testing into their own laboratories, which is increasing capacity. Where one of the big challenges though that we're facing is having the right supplies to collect the test. So the test is a swab out of your nose, typically, sometimes out of your throat, and so there's special swabs that need to be used to do that, and there's special equipment that for the persons who would be collecting those swabs, who's sort of taking your nose sample, need to wear in order for them to be protected around that. So it's just those nuances that I've made the collection of specimens and getting them to the laboratory and getting them run that have just made this a lot more challenging. We seem to have greatly improved our capacity to test, but the supply chain is, I think, what's really slowing things down. But I will tell you, there are several groups we're actively working on this. It is a huge goal to improve testing, not just in the metro area, but all over the state. It is a governor's objective. It's an objective for the health departments in the metro area in particular. So, the immediate answer is that if someone is sick enough to need emergency care, seek that, but of course make sure that you let them know that you have symptoms of COVID so that the healthcare providers can take appropriate precautions to take care of you. But if you're unable to get testing, and those symptoms, the symptoms that you brought forth are very classic symptoms for the COVID infection. And so if you're able to manage if someone who is sick is able to manage their symptoms at home and take care of themselves at home because they're not severe, still important. There's a good chance that you may have COVID infection, but make sure that you're taking care of yourself at home and keeping away from others. And at the Tri-County Health Department website, we have a couple of really helpful fact sheets about taking care of yourself at home, and also how to communicate with your household members to keep them safe as well. And those are both available on our website.
That's great information. Thank you so much, and thank you for all you're doing too. I know y'all are working really hard.
We are trying, and we appreciate what the public is doing, the social distancing, and really taking to heart the stay-at-home message. I mean, I know it's an order, but it's a strong message. It is going to make a difference. It really is. This infection, this disease spreads from person to person, and when we can separate ourselves and prevent that spread from happening, that is going to be a significant effort to move us out of this issue, and I feel confident that we'll be able to do that.
Great. Thank you again.
Thanks, Sherry. I'm going to go to another caller in a moment. Nancy has a good question, but before we do that, we want to talk a little bit about masks. We've had several questions, people asking where they can get masks. We also have one person that's offering up masks. So the person who's offering masks, we will contact you. And for the people that are looking for masks, we have a resource. Mayor?
Yeah, I was going to jump in with some information, but I was hoping that Dr. Albanese could speak to the question of why we need to wear them, because we have quite a few residents saying, is it necessary? Is it necessary when I go for a walk? Is it necessary when I go to the store? So, Doctor, if you could answer that first, then I can provide some resources for our residents.
Hi, sure, I'm happy to. Again, Dr. Albanese here with Tri-County Health Department. So, so maybe I'll just try to back up a little bit. So I mentioned that this disease is spread from person to person. It's spread when a person who is infected has the virus in their nose and mouth. That is the primary way this gets spread. So when they talk, when they cough, when they sneeze, particularly when they're having symptoms, and they may have very active coughing, because that's usually a prominent symptom, it releases these particles from the mouth, and if you are nearby, and why we use that 6-foot radius, if you are nearby that person, those infected droplets can land on your face, they can land in your nose or your eyes, and they can even land on your hands, and then if your contaminated hands touch your face, they enter your body and they can cause infection. So that's the process we are trying to break the chain of. We're trying to break the chain of spread. So when you are physically separated from someone in a sufficient distance, and again why we use the 6 feet, then the opportunity for those infectious droplets to, come out of someone's mouth or nose and sort of land on you, to sort of make it a very simple description, goes away. And so the social distancing is important, the keeping people from congregating in places where we like to go, our restaurants and our malls and so forth, but we have to separate people and keep them separated to release that opportunity. New information released from the Centers for Disease Control and Prevention, the CDC, this week that has been under study for a bit, but released the end of last week and this week, tells us that even before, so if someone is infected, it can take up to 2 weeks before their symptoms start. And then once their symptoms start, we sort of know what's happened. But what has been the information that we have learned is that a couple of days before the symptoms start, there's probably still some virus that can be released from their nose and mouth. And so that makes it tough, right? Because you say, well, once symptoms start, sure, it's obvious. You have your fever, you have your cough, you're not feeling well. I know you're sick. Now I know to stay away, right? But with this new information, it creates a problematic twist in the puzzle, which is that even before symptoms start, the infection can spread. So now what do we do? Because someone can't say, I'm sick, I'm going to stay away, I'm going to try to isolate myself so I don't expose other people. Now we have to worry about that period of time beforehand. So the addition of the recommendations of wearing a mask while out, while in public, is to try to address that exact problem. Because we could be, I have to go buy groceries. I have to pick up something at the pharmacy. I need to put gas in my car. There's some things that need to be done outdoors that may cause you to have some interaction with around other people. And so wearing of the mask is intended to add an extra layer of protection to prevent exposure of the virus to your nose and mouth. Now, is it perfect? No, it's not. But it at least affords the opportunity to physically cover your nose and mouth to do a couple of things. One is, if you are unfortunately infected and your symptoms haven't started, but it's a couple of days before, at least when you're talking, that it prevents you from releasing those infectious droplets into the air, and then potentially by wearing the mask, it sort of blocks the virus or it reduces the risk of the virus potentially entering your nose and mouth if it gets released around you. So like I said, this is not a perfect exact science solution, but a lot of thought went into this before the CDC released that guidance. In Colorado, we rapidly adopted it. This has been a message coming out of our health departments and the governor's office. So I would strongly encourage individuals to wear a mask. Now you say, well, where can I get one? Surgical masks, I don't know for the general public that we can find any, and quite honestly, we're trying to reserve those for our healthcare workers and our first responders and our folks that work in the long-term care facilities, our nursing homes and so forth, where we have such a vulnerable population, to try to spare those supplies for those individuals, our heroes on the front line, trying to take care of patients and keep them well. So the other option is the cloth masks. And boy, I wish I had an answer. Honestly, I've been online looking for them too. And we've had wonderfully creative individuals in our communities who know I don't know how to sew, but boy, I'm so happy when I can find a friend who does to see if they're able to make some cloth masks. That are washable and reusable. Again, if you wear it for some period of time, you need to throw it into the wash and clean it off and get it cleaned through the wash and heat cycle in the dryer, so that they're reusable. But like I said, this is not a perfect answer. But the more that we can add up the steps that we are doing to protect ourselves, so the social distancing, the staying home when you're sick, the stay-at-home public health order so that we avoid people congregating close together, and now the masks are all adding up. They're another layer to help us knock this down and knock this pandemic down and slow things down in our communities. So a little bit of a long answer, but I hope that provides you the background.
Yes, I really appreciate it. Thank you. And another resource is a website, coloradomaskproject.com. And that is a really great place if you have masks to share, you can volunteer, and if you need a mask, you can request one there. So it's a double-sided website. So that's coloradomaskproject.com.
Let's change it up a little bit. We have Nancy has a question about how long the at-home order is. Nancy, are you still there?
I sure am.
So what is your question?
Okay, when this all started, the governor said that we were going to be on the stay-at-home order through the 17th. However, Adams County, and I understand this, went to the 11th. He has since yesterday, he announced that we are to be under the stay-at-home thing till the 26th. Are we, as a county and as a city, going to adopt that, or are we staying with the 11th?
Thank you for your
question,
question,
Nancy. Do you want me to answer that? This is Dr. Albanese. Do you want me to answer it?
Sure.
Yeah, hi.
Sure,
Hi,
go
it's
ahead.
Dr. Albanese. So to clarify, the governor's order is universal across the state. So while initially there were some jurisdictions, Denver County and then actually Tri-County and the other Denver Metropolitan Health Departments had set up an order that was longer than the governor's order of the 11th. We ended up rescinding once the governor. I think ours originally was to the 17th, and then the governor followed the same day with an order through April 11th. Tri-County Health Department ended up rescinding our order from the 17th because it was too confusing. So we just went with our residents to follow the governor's order. I think the governor wisely extended the order now to the April 26th statewide. I think that was a wise decision. We have accumulating data from scientific analysis, trying to what we call model the course of the outbreak, trying to use statistics to predict which way the outbreak can go. And the data is pretty clear that when we can use the stay-at-home orders to really maximize people staying home and staying away from each other for several weeks, it has a more profound effect. And so I think the decision to extend it to the 26th, which of course was the governor's decision, was the right one to do. So everyone in our jurisdiction, in Adams, Arapahoe, and Douglas County, need to follow that. So that's the date that we're currently using. Now, I will qualify that two ways. One is it is at least to the 26th. It is possible it could be extended beyond that. Many people in our governmental agencies are working on trying to mitigate the negative impact that it has economically, in particular, on businesses and people's employment. We're very sensitive to that, and so they're trying to do a lot of work simultaneously to make this feasible for people to be able to follow the order. But we are being driven by a public health crisis. We are being driven on trying to prevent people from dying from this disease and getting serious illness from this disease. And so the order is important. So there's going to be flexibility. We are assessing every day where we are at with the pandemic. And if the need, and every day leading up to the 26th, there's a new assessment on how we think things are going and to what extent we think the social distancing is working, which we think it is, and really when is the time to release it or when is the time that we need a little bit more. So these are not decisions taken lightly by any means. There is a huge amount of discussion and input that goes into a public health order. They are not taken lightly. We know how serious they are, but we believe that they are extraordinarily important to get us in a better place. So right now, as it stands for you in Northglenn, it's April 26th, but subject to change.
Excellent. I just have one more quick thing, if that's okay.
Sure.
Okay, I've heard a couple of people now say, what do we do about the masks because we don't sew? And I have found several things on YouTube and in Facebook that give instructions for how to make a mask that's effective and it doesn't require any sewing. They're very easy to do and they're very quick to make.
Thank you,
Great
Nancy,
tip.
for pointing that out. That's exactly how I made mine at my house, was a little YouTube tutorial with my kids. So that's a really good thing. And I want to thank you again for your question, because if you had that question, a lot of other residents had that question. We are all trying to stay informed and up to date on the changes. And so I think if I could recommend anything to our residents is just to remind you to stay informed, to ask the question. If you don't know, don't make an assumption. Give us a call and ask for clarity. And so I'm really glad you did that. Thank you.
Thanks,
Thank
Nancy.
you.
Bye-bye. Before we go to our next question, did we want to talk a little bit about whether you have to wear a mask when you go, what's the question right there? It's just walking outside?
Walking alone.
Yeah. Do you have an idea where you can get masks to wear in public? That's not the one. We had somebody asking, like, when should you wear a mask? Should it be any time you leave your house?
Hi, Dr. Albanese again with Tri-County Health Department. So if you know you're going for a walk, if you're going for a walk and you know you're going to be around absolutely no one, like I'm not going to see anybody, I'm just going to be completely by myself, then wearing a mask is not imperative, right? It's just if you're saying, well, I'm going to go for a walk, but you know what? I might run into my neighbor, I might run into a friend, I'm going to be walking my dog, and I might run into a co-dog walker. You know, in those kinds of situations where you think there's a pretty good likelihood that you're going to be passing by other people, then that's an opportunity to wear that protection. Certainly, if you're having to run your errands, essential errands, grocery store, gas station, pharmacy. You know, I have to fix something in my house and run to a hardware store. You know, those kinds where there's almost certainly going to be opportunity for you need to be walking by people, trying as best you can to keep your 6 foot distance. Those are the situations where I think the mask would be terrific to use.
Okay. We had a question about what people who typically go to chiropractors and acupuncturists should do since these services aren't available. What is Tri-County Health recommending for people that typically use those services?
Yeah, hi, Dr. Albanese again. I'm not sure I have a great answer for that, and really aren't able to answer any specific medical condition questions. One thought is to, while those services are not able to bring patients in, it's possible that the caregivers may have some ideas for some home care options, to things that you may be able to try at home to help alleviate your symptoms. So, sorry, that might be the best that I could offer. Thanks.
Thanks. All right, so just a reminder to those of you that are on the call, if you want to ask a question, just hit *3. If you're watching the live stream audio online, you can just type in your question. We still have quite a few questions in the queue, but most of them are online, so we're going to go to a few of those. I'm sorry, which one?
Do you want me to tag one, the license?
Yeah, we had a question about if your license plate tags, it's a call, sorry.
Top one.
Oh, there we go. Andre, hopefully you're ready to talk.
Yes, I'm here.
Okay, great. Ask us your question, Andre.
So my question was about license plates and stuff like that. So my vehicle, my plates are expired, so I'm just trying to figure out how we get plates and also what the officers are doing when we get pulled over or anything like that for expired tags.
This is City Manager Geyer. Thank you for that question. Northglenn officers, we are not ticketing individuals for expired tags. You can visit Access Adams online. That's ADCOGGOV. I'm sorry, let me start over. ADCOGOV.org, so adamscountygov.org, and you can take a look and see what you might be able to do online from their online service menu. But Northglenn Police, we are not enforcing expired tags. I can't speak for other law enforcement agencies, so hopefully that helps
All right, did that answer your question, Andre?
Yes, yes. So so to get our license plates, we just have to wait on that when they open back up, or because I tried to do it online, they sent me a letter, but since my vehicle is a brand new vehicle, I'm not allowed to register it online. I have to basically do it in person. So you know when those offices will be back open?
We do not know when those offices will be back open, but if you want to, I think we have your phone number. Do we have his phone number?
Yeah.
I can reach out to someone at Adams County and have them give you a call with more information about how you can go about getting that service and when.
Okay, thank you.
Thanks for calling. Yeah. Thanks for calling. All right. So we have somebody. Donna, are you still on the line? Let's see if we can get to Donna.
Yes, I am.
Hi, Donna. Why don't you go ahead and ask your question, which is really more code enforcement question. Go ahead.
Yeah, I have two questions. And I'm over on the other side of the highway, and it seems like every summer we have the issue that people, they cut down trees and everything, and they just burn them in their backyard. And last year we had the situation, and we had to have the police out here because it was so smoky, and they said, well, as long as they burn it in a pit, there's nothing really they can do. But these aren't people that are sitting out there enjoying a fire. They're just burning wood. And for the last 3 nights, it's been so bad. And then my other question is the drag racing. They go down I-25. I think they go 104th up Huron, and then across 20 back down. And, it starts about 11:30 at night, and it's, consistent.
City Manager Geyer, do you want to tackle that one?
Sure. I'll start with drag racing. We have received complaints about drag racing, so what I'd recommend, I appreciate you giving the approximate time at night. Please do call dispatch, the emergency line through the police department, and that way a dispatcher can let officers on patrol make them aware of the situation. So I apologize for the inconvenience there, but we are aware that it has been an issue just within the last few days. I believe over in the Huron area, north of 104th, south of 120th. So please reach out to the police department on that. Your other concern about neighbors burning wood in their backyard, also please contact the police department. And we will send an officer out to look into the situation and assess whether or not it's an appropriate burn. And certainly, we want to make sure that neighboring properties are safe and free of risk from, potential fire spreading. So just reach out to the police department and let them know. And I will follow up from this call with Chief Jim May and make him aware of the concerns that have been raised on this call so that he can let his sergeants and commanders know, and that way anytime a new shift comes on, they're advised as to what type of issues we're hearing about within the community.
Well, we did that last year because, we had somebody that's, we had those trees that blew down, and it was like every night they would just, they just cut a piece and they put it in their steel container. And, we had the police out twice on one day because it was just so hard to breathe. It was in your house, and they said, the city ordinance, as long as it's in an approved, container, that they can burn. But it's like they shouldn't be allowed to just do away with their trees. Burning in a fire pit should be people sitting out there and enjoying it, not a means to get rid of the trash. So, we ended up having to call Clean Air Colorado, and the state came out and dealt with them. Because, when you have police out here twice in one day and they say they can't do anything as long as they're burning it in a pit, that doesn't work with the rest of us. And my neighbors have asthma, and it burns it hurts to breathe, it hurts your eyes, and it's just, literally they start at 5 o'clock and they'll burn till, 9 o'clock, 10 o'clock at night.
I understand, and North Metro Fire is probably our better resource given your situation. So we're going to take down your information, and I'll provide follow-up either from the police department or someone from North Metro Fire to reach out to you. So I'm sorry that you've been experiencing this. There are certain regulations both on North Metro side and the city side that residents need to follow, and it sounds like maybe that that isn't happening. So we'll follow up with you and make sure you get good information, and hopefully this gets resolved.
Okay, thank you.
Thanks for calling, Donna. We have a new question from Royce that I think is a good one. Royce, hopefully you are still there. Royce,
I'm still here.
Great. Why don't
Yes,
you ask
I
your
am.
question?
Okay, I have two questions, but the burning one I have is regarding well, my wife and I are both in our 70s, and my wife is severely immunely compromised, so we're just fanatical about staying in the house. We haven't been outside for like 4 or 5 weeks. The concern that I have is now with warm weather coming, it gets a little stuffy in a house, and we're concerned about opening windows, maybe pulling some air in from outside. If it gets even hotter, maybe even running a swamp cooler. Being that my wife is so compromised immune-wise, we're just concerned about leaving any kind of outside air in the house. It may seem like a silly question, but it's kind of a burning concern of ours.
Dr. Albanese, are you still on the line?
Oh, yeah. Yeah. Hi. You know what? Again, Dr. Albanese with Tri-County Health Department. Thanks for that question. And I hear you. So all of the data that we have about this virus is that it is not spread through the air. And so let me do a little comparison. So I earlier on the call, hopefully you were able to listen, I sort of described, that it comes from droplets in your nose and mouth. When you cough, sneeze, or talk, those droplets can be released briefly within around a 6-foot radius, and then they fall down. So if you were if I had COVID-19 and I was coughing, it would just sort of release from my mouth and kind of in an arc and fall to the ground. So the 6-foot thing matters because if you are within that 6 feet, then instead of that virus, droplet falling to the ground, it falls on you. You know what I mean?
Sure.
And that it can land on your face. So there isn't evidence, and of course now we're well into the pandemic worldwide, and there isn't evidence to say that it can travel far through the air. The best comparison I can give you to that is measles. Right, measles virus travels through the air. So someone with measles, has that germ in their nose and throat again. But when they release the germ from their nose and mouth, it ends up kind of floating through the air for long distances. And so that's a very, very different situation. That you have to be concerned about. Being in the same room 30 feet away, and you still might get exposed, because it's traveled through the air. So there isn't harm about you opening your window. There isn't harm about you using your swamp cooler. So you have taken appropriate precautions, albeit as difficult as it might be, to stay at home and very conscientious about protecting your wife. But you can open your windows and you can use your swamp cooler. It's not going to introduce anything worrisome into your home from a COVID perspective.
Okay. Well, I appreciate that. We're concerned. And I had a second question, but I guess it's not really that important. So you've answered my primary one, and I appreciate it.
Thanks, Royce, for calling in. We appreciate it. We're going to jump over to another question about a mask, Dr. Albanese, so you might want to stay on. Nancy, are you still there?
Hello.
Hi, Nancy. Would you ask your question, please?
Yes. I was thinking, how they're saying to have the two sides of the fabric for the mask, and they say put a piece of paper towel in there. I wanted to know if it's better to put a dryer sheet in there. Would that protect you more?
Hi. Yeah, hi, Dr. Albanese here. I think that the masks, for the most part, the mask can be made of a cloth material.
Yes.
As a way to serve as a covering over your nose and mouth. It's a bit less that it's actually a filtering mechanism, quite honestly, for most people trying to make these things, rather as just a physical protective barrier. You've got to be able to breathe through it, right?
Oh yeah, you can. I've checked it out.
Yeah, so I don't know that there's, for these homemade situations, which all of these are going to be, the surgical masks that are and the very specialized masks that are used in the healthcare setting and in operating rooms and things like that, they have a whole different design and purpose about covering and filtering. The cloth masks that are being recommended by the CDC and in Colorado are just to serve as a covering for your nose and mouth so that you can breathe through it. So I don't know that I would really get too involved in a filtering piece of it. It's just that it's actually physically covering your nose and mouth.
Okay, I just thought since it's denser, that would be better.
Like I said, just the cloth itself is going to be, for the most part, serving the purpose.
All right. Thank you very much.
You are very welcome.
Take care.
All right, so let's jump to some online questions.
Can I answer the cyclists and joggers one?
Yeah, so go ahead, Mayor.
So this is Mayor Leighty again. So I'm looking at sort of some trends in our online questions, and there's a couple that have come up. So Stephen has asked about cyclists and joggers and if they have an increased responsibility to distance themselves. And there's also some other questions about how people are behaving at the stores when they go into grocery stores to pick up their essential needs. They're not always making good choices. And so there's some questions about what do we do about that. So the most we can do is to do the right thing ourselves. I really don't want to encourage anyone to start policing someone else because we don't want to have tension or have a conflict. But we do, I agree with Stephen that our cyclists and joggers and walkers, there's some other questions about people that are walking in packs, walking with their neighbors, and that's that sort of hard situation where we want to be taking care of our mental health, and sometimes connecting with others is that's how we've done it. So it's hard to go for a walk alone. It's hard to go for a walk without maybe your best neighbor friend. So it is going to be upon all of us to make the right choice, and we just need to help our neighbors and friends be informed. And so as much as we can get the message out, as much as the city can communicate the guidelines, the recommendations, all of these great questions about masks, I think were just awesome tonight. So thank you, Dr. Albanese, for clarifying a lot of those pieces, because unless residents ask for clarity, we could end up pretty confused. So I do believe that anyone out and about has a responsibility for staying separate and being respectful of each other. We've had some questions about dogs off leash. That's just an issue no matter what time of year we're in. So we need to make sure that we're all following the rules and being responsible neighbors and friends.
So I'm going to break in. We're going to be wrapping up the call pretty soon. If we did not get to your question, just so you know, we will answer your question and post that both online and try to reach you personally if we have your information. So thanks to everybody that asked questions, and if we didn't get back to you, somebody will reach out to you if your contact information is there, and if not, they'll be posted online. And I'll hand off to the mayor to say thank you to our guests and any closing remarks she has.
Do you want to answer the rent one?
Real quick, the mayor is asking me, this is City Manager Geyer, about the question regarding rent. Adams County, so rent does not fall under this jurisdiction of the City of Northglenn. However, evictions and things along those lines are within the jurisdiction of the county. And again, we reside in Adams County. So I'm going to provide a resource for you. If you go to the website, it's called adamscountycovid19.org. They have just launched a new web page, and when you go to this site, you can see at the top of the web page that there's a rent assistance bar, which drops down to multiple resources for rent assistance. I know that the governor, as well as other officials in the state, have encouraged different businesses as well as property owners to not evict individuals. So if you do find yourself in a situation of eviction, there are certain legal resources that are included on that page, including Colorado Legal Services, and they can offer assistance and guidance to you. But there's, like I said, dozens of resources on that page that you can find support given your situation. And then if you continue to have problems really connecting with one of those organizations, just feel free to reach out to either me via email. You can reach out to me at hgeyer@northglenn.org, or any city staff member here at the City of Northglenn.
All right, thank you. I really appreciate it. So in closing, I just want to thank Clay Cunningham from Community Reach for being with us, and Dr. Albanese from Tri-County Health Department for joining us tonight. We really appreciate your time. And just an extra thank you to all of the Northglenn residents that called in, listened in, and asked questions. There's no bad question in a situation like this. We just need to ask it. So we will post a recording of the town hall and write up the questions and answers. You can find those at www.northglenn.org/virtualtownhall. I wanted to do a really quick plug before we completely say goodnight. We have a new program that will be kicking off on Monday, and it's super exciting, and so I want you to look for the information. It's a Northglenn Hug program. So you can request that a Northglenn Hug yard sign be delivered to a friend or neighbor to cheer them up. So you can look at our website starting Monday or our social media outlets, and they're for yards specifically. We don't want to put them in parks or medians, and it must be a Northglenn resident only. But it's a really fun way. If you remember back in school when we would deliver maybe a Secret Santa gift or a Valentine Graham to a friend, it's just a really easy way for you to cheer up a friend. And so look for that, because it's going to be, we're hoping it spreads like wildfire throughout the city. Do you have something else? Okay. So thanks again, and till next time. Have a good night.